Hi, everybody. Happy July to everybody who's joined us so far. Thanks for joining our Speak for Health Advocacy webinar for leaders. Just wanted to let you guys know that we are recording this session to post it later for other APHA members to view and watch and learn from. So the session is being recorded. I'm admitting people in the waiting room now, and we'll get started in a minute or two. Thanks again for joining. Okay, so we've got most people admitted from the waiting room. Once again, thank you so much to everybody who is joining us today for the Speak for Health Advocacy webinar for leaders. I think we can go ahead and get started now, and we'll continue to admit people from the waiting room as they join us. But I'll go ahead and share our slides with you all so that you can follow along as we do our Speak for Health presentation. And Don Hopper, who I'm sure many of you know, will be starting our presentation today. So here we go.
All right, thank you, Jordan. We will go ahead and get started. I just want to welcome everybody to our Speak for Health webinar for leaders. Let's go with our first slide. So just an overview of APHA's advocacy priorities for this year. Strengthening public health funding and agencies, supporting efforts to address the health impacts of climate change, support innovative efforts to expand access to comprehensive affordable health coverage, support public health approaches to address gun violence, advance racial and health equity, and maintain strong public health regulations. So we'll start off with public health funding. This is a topic that APHA advocates for every year. We primarily focus our efforts on funding for the Centers for Disease Control and Prevention and the Health Resources and Services Administration, also known as HRSA. And of course, our goal is to increase funding for all of the important programs at both of those agencies. And we also, of course, oppose the inclusion of any harmful policy riders or other efforts to block funding from various public health programs. So just a general overview of how the process works every year when it comes to the annual appropriations process. Each year there are 12 annual spending bills. And the one that we focus on primarily is the Labor, Health and Human Services and Education Appropriations Bill. And that includes all the discretionary funding for most federal agencies. And discretionary funding is just that. It's up to Congress to decide how much money each agency gets every year for a variety of programs. And this spending must go through the annual appropriations process every year. And as I said, Congress must do the allocating. And the process generally, this is just a rough outline because it never exactly follows this, but it generally in February, this did not happen this year, the president submits his budget request to Congress. It's not unusual during a new administration in the first year for their budget request to be late. And this year, the Biden administration introduced their budget in two parts. The first part came in April for the discretionary requests, and the second part came in May. And then Congress, of course, holds hearings on the president's proposed budget to hear about their priorities. In April through June, the House and Senate generally are working on drafting the legislation to fund the agencies. And then through July and September, the committees take action on those bills. And eventually those bills will end up on the House and Senate floor. And once the House and Senate agree, because they often will pass bills with different funding levels, once they go to conference and agree on a final bill, and they both repass that bill, and it goes to the president for his signature. So next slide. As I mentioned, the president released his budget in two pieces in April and May. His proposed budget would increase funding for many public health agencies and also includes a number of other proposals that he included in his American Jobs Plan and American Families Plan. And many of these provisions in those two proposals are the things that you will see included in the upcoming infrastructure legislation that Congress will consider probably in the fall or hopefully before the end of the year. That timing never quite works out as they usually plan it to. So that's kind of on the horizon as well. As I mentioned, APHA has been advocating for increased funding for CDC and HRSA, both on the Hill and with the administration. And the congressional process is currently well underway, particularly in the House. Our asks this year were for at least $10 billion for CDC, at least $9.2 billion for HRSA, and we're also supporting this is a provision that's separate from the appropriations process, but certainly related. We are supporting the inclusion of a $4.5 billion long-term mandatory funding stream for public health infrastructure. And that is reflected in a bill that was introduced by Senator Patty Murray called the Public Health Infrastructure Saves Lives Act. And we're currently talking to key offices in Congress to try to encourage them to include that legislation in the upcoming infrastructure legislation that they will consider later this summer and into the fall, as I mentioned earlier. So next slide. Some updates on where we stand now on the appropriations process. Just last week, the House Appropriations Committee passed their fiscal 2022 labor HHS appropriations bill. It provides more than $10.5 billion for CDC. That's a $2.7 billion increase over the current year. That includes $1 billion in new flexible funding for state and local public health infrastructure, an increase up to $106 million for strengthening the public health workforce, $110 million for CDC's climate and health program, $50 million total for gun violence prevention research, and that includes $25 million for CDC, and the National Institutes of Health would also receive $25 million, so a total of 50 under the House bill. $153 million for CDC's social determinants of health program, and $150 million for the ongoing effort to modernize the data systems at CDC and state and local health departments. Regarding HRSA in the same bill, a total of $8.7 billion for HRSA. That's a $1.6 billion increase over the current year. And some highlights, $1.8 billion for the health centers program. That includes the discretionary funding for community health centers and school health center programs. $2.7 billion for the Ryan White HIV/AIDS program, which of course provides services to many individuals who are HIV positive. $1.2 billion for various maternal and child health programs, $400 million for the Title X family planning program, and $1.6 billion for HRSA's Bureau of Health Professions. As I mentioned, the House, these are all reflected in the House bill. The Senate has not yet taken action on its bill, so that is to come later in the process. The next topic I'll talk about is climate change and health. APHA's goals are to support federal, state, and local health departments to ensure that they are prepared to address the health impacts of climate change. And one way that we are seeking to do that is through increasing funding for CDC's climate and health program. I had mentioned during the previous section that the Labor, Health, and Human Services bill contains $110 million for CDC's program, and that is what APHA requested. That's a $100 million increase over the current year's funding level. And of course, we're always looking to ensure that there are strong public health provisions in any additional climate legislation that may be considered in Congress. We are also supporting efforts through the regulatory process to ensure that EPA proposes regulations that do reduce greenhouse gas emissions. And of course, we'll oppose any efforts to weaken EPA's ability to regulate greenhouse gas emissions under the Clean Air Act. Fortunately, in this Congress and this administration, that's probably not much of a threat, but it has been in previous administrations. President Biden has called for key climate change investments in the American Jobs Plan, which, as I mentioned, will likely be part of the infrastructure bill that happens later this year. Some of the other provisions he's calling for are investing in electric vehicle development, upgrading and retrofitting buildings to make them more efficient and resilient, ensuring that provisions are equitable and address environmental justice issues. President Biden is also reviewing and rescinding a number of the rules that were put into place during the previous administration that actually weakened climate regulations under the Obama administration. And the president's budget also contains a number of increases for climate-related activities at a number of federal agencies. So we were happy to see that. As I mentioned, our key asks are adequate funding for the CDC climate program. We're asking for the $110 million. We're also supporting the Climate Change Health Protection and Promotion Act, which would require the Department of Health and Human Services to develop a national strategic plan to address the health impacts of climate change and also assist state and local health departments with additional research, data collection, and other technical assistance. We're also monitoring additional efforts in Congress, as I mentioned, to reduce climate pollution. A lot of this will likely happen in that infrastructure bill. We're also looking, we've joined with a number of other health organizations to encourage the Department of Health and Human Services to get more engaged around efforts to address the health effects of climate change beyond our support for the CDC program. So next slide. Access to health services. Our goal is to, of course, uphold the Affordable Care Act, support safety net programs that provide services to millions of Americans, and maintain the Prevention and Public Health Fund. Access to health services, the landscape. Yay, everybody was, at least at APHA, hopefully all of you were very excited when we all saw the Supreme Court reject the conservative state challenge to the Affordable Care Act. So that let us at least momentarily breathe a sigh of relief and not have to worry about that case in the federal courts. APHA had submitted a amicus brief to the court with a number of other deans and scholars at various public health institutions across the country, urging the Supreme Court to uphold the act. So we were very happy with that outcome. The American Rescue Plan Act, which was passed earlier this year, in addition to providing a lot of additional resources around public health workforce and other efforts to address the COVID-19 pandemic, also expanded and enhanced the premium tax credits available to individuals who get their insurance through the Affordable Care Act marketplace. So those premiums are now more generous and available to more people for the current year and for fiscal year 2022. And there may be an effort to further extend these tax credits to additional out years as part of the upcoming infrastructure proposal later this year. And of course, other additional legislation may appear down the road, so we'll keep our eyes on that. Of course, we always advocate for the full allocation of the Prevention and Public Health Fund, which was created under the Affordable Care Act. Much of that funding does go towards CDC programs each year, and the House Appropriations bill did allocate the majority of that funding to various CDC programs.
When we had this kind of robust.
Okay, we'll go to the next slide, and if folks could all make sure that they're on mute, that would be great.
Approach to
okay, access. So just briefly talk about the prevention fund. I think most of you are familiar with the fund. It was created under the ACA. It supports community prevention and clinical prevention programs. You can check out APHA's Prevention Public Health Fund fact sheet for information about how the fund was allocated in the current fiscal year. Of course, we'll update that after this year is done. It makes up about 11% of CDC's budget. And of course, Congress has the power to eliminate the fund or redirect the money to pay for other things. Luckily, the many attempts back in 2017 by Congress to overturn the ACA, which would have gotten rid of the prevention fund, failed. And we do not have any serious concerns that this Congress or this administration will try to use the fund for anything inappropriate. So we're in a good place on that. Next slide. So our key asks, of course, we want to further expand those premium tax credits that were included in the American Rescue Plan Act. I'm pretty hopeful that that will happen. We would like to see effort to provide Medicaid coverage to those individuals who live in states where their states have not expanded Medicaid coverage as they were intended to under the ACA. So there may be some provisions to assist those folks in upcoming infrastructure legislation. APHA is actually supporting a bill by Senator Warnock that would create a federal program for people who live in the states where the states refuse to expand Medicaid, so they can directly get relief and coverage through the federal government. So that's one potential option moving forward. Of course, we will continue to pose any additional challenges to the ACA in federal courts. We'll continue to advocate for the prevention fund, and we will keep our eyes out for additional efforts to expand access for additional provisions, whether that be through the Medicaid program. I know there's likely going to be an effort to expand the benefit package under the Medicare program, which could find its way into the reconciliation bill as well. Gun violence prevention. We have 3 primary efforts that we're supporting. The first is funding, which I talked about earlier, for the CDC and NIH to conduct gun violence research. Again, we're very pleased that the House bill contains $25 million for each of those agencies for a total of $50 million. That's a doubling of the gun violence research funding. So hopefully that will make its way all the way to the president's desk, but that's where we are right now. And regarding legislation to require universal background checks, this did pass the House of Representatives in a bipartisan fashion earlier this year. So far has not moved in the Senate, but we will continue to push for that moving forward. And there may be efforts as well to address issues around extreme risk protection orders that would allow caregivers and family members and others, law enforcement, to remove guns from folks that they think are a danger to themselves or others. So that's another effort that Congress is considering. We did have one, I'm just going to answer this question now. We did have one question about efforts to expand Medicare. Senator Sanders is really pushing to include dental, vision, and I'm blanking on the other one, dental, vision, and blank benefit. There are a number of things that he's pushing to expand in the Medicare program. So that is something that will likely be part of those discussions when it comes to expanding access. Just a snapshot on going back to gun violence prevention. Gun violence is a leading cause of preventable death in the United States. In 2019, which is the most recent data we have right now from CDC, nearly 40,000 individuals were killed as a result of gun violence. And of course, tens of thousands of additional individuals suffered non-fatal injuries. So we are really trying to look at this from a comprehensive public health approach to address this important issue, and including things like extreme risk protection orders, background checks, and additional research, so we really know what works and what doesn't when it comes to addressing gun violence. Next slide. So our key asks, again, we support the universal background checks legislation. It did pass the House, as I mentioned earlier this year, in a bipartisan fashion, and is awaiting Senate consideration. We also supported the Enhanced Background Checks Act, which would give the agencies that do background checks additional time to run those background checks. And of course, we mentioned funding for gun violence prevention research at CDC and HRSA. So those are all key asks for gun violence prevention this year. And now I am going to turn it over. Actually, let me just quickly answer this question. We had a question about emphasizing mental wellness for frontline public health workers. I know there was an MMWR article on this, and I did pass that on to our media and communications folks to highlight that, but I'm sure there will be additional discussions going forward. Hopefully Congress is going to take a broad look at the pandemic and its implications across the board. And I'm sure that mental health issues related to first responders and public health folks who work in state and local health departments, et cetera, will be part of that discussion. So yes, that is certainly something that we will keep in mind. Jordan, I'll turn it over to you.
Thanks so much, Dawn. So Dawn just outlined and broke down several of our advocacy priorities in Congress for 2021. So our next advocacy priority for the year is the priority of advancing racial equity and health equity. And some of the subheadings here underneath advancing racial equity are: one, addressing social determinants of health; also addressing racial disparities in health outcomes. A big one is maternal health and maternal mortality, which has been popping up a lot lately, especially in committees like the Energy and Commerce Committee that have been taking a closer look at that crisis. And finally, addressing police violence and the harm done to Black communities and other communities of color because of that. And one as well as just making sure that we're maintaining a racial equity lens within all of our other priorities. So within gun violence and within climate change as well. So some of our key asks under this priority include the Improving Social Determinants of Health Act of 2021. This hasn't moved vote-wise in the House or Senate yet, but there was recently a hearing on it in the Energy and Commerce Committee. And Dr. Georges Benjamin of APHA submitted a letter to the committee in support of the bill and supporting it moving to markup and a full House vote. And then hopefully there would be Senate action as well. Another key ask under this priority that APHA supports is the Black Maternal Health Omnibus Act. This advances a lot of the work that's already being done in maternal health and maternal mortality. There was a bill passed, I think in 2018 or 2019, that established maternal mortality review committees and provided funding for those to be in every state, whereas before they were just in like 25 or 30 states. And those would allow more data collection around maternal mortality. And this bill would boost efforts now that we do have that data collection, as well as direct some research around, like, for instance, COVID-19's impact on Black moms and their mortality rates. So lots of cool stuff to advance the research discussion and address linking to care for moms and kids and stuff like that. That one has not moved yet in the House or Senate, but we're always hopeful. Another bill that we support under the racial equity priority is the George Floyd Justice and Policing Act of 2021. This bill includes a lot of provisions to hold police departments and officers more accountable and hopefully not just reduce the violence that occurs, but also give communities more solutions for how to address violence outside of police departments. So last Congress, APHA endorsed this and it passed the House, but did not ever pass the Senate. And once again, this Congress, it has again passed the House, and we are awaiting Senate consideration again. And finally, another bill that we support under this priority is the Health Equity and Accountability Act. This is usually introduced by the Tri-Caucus and includes a lot of different provisions addressing health equity and social determinants of health, spanning research and connecting people to care, making sure that services are offered in culturally and language appropriate ways and things like that. So those are some of our key asks. If you're ever going into a meeting wanting to discuss racial equity, we'd love for you to mention some of these. And one of our last priorities that we'll be discussing is the priority of public health regulations. And our goal here is just to weigh in with agencies in the administration to advocate for strong public health protections. And that includes both trying to strengthen public health regulations while also opposing regulations that come out that are bad for public health. So I'm sure many of you know what regulations are, but they're basically rules put in place by federal agencies. And in the case of public health, these rules are interpretations of legislation that can protect the public from serious health threats, including deadly air pollution, toxic chemicals, food contamination, and workplace injuries. So APHA is just working to try to strengthen the federal regulatory process so that we are getting rules and regulations that are benefiting the public's health and protecting people from all of these things like air pollution and toxic chemicals. And the landscape and some of the things that have happened recently underneath the priority of regulations, APHA has provided a lot of support for newly proposed rules, one of which is a new Title X rule from HHS. I'm sure many of you heard about the previous Title X rule that came out under the Trump administration that did a lot of damage to Title X clinics that were receiving Title X funding under that previous rule were basically restricted from providing abortion care, referring for abortion care, or educating about abortion care. And that caused a lot of clinics to no longer be able to receive funding, and a lot of people went without care as a result, which should never be the case. And HHS this year announced a new Title X rule that would rescind that previous harmful rule and go back to the original purpose of the Title X program, which is to provide family planning and reproductive care to people who need it, focusing on communities where that care is offered the least otherwise. So APHA supported that new rule when it came out, and we hope to see it move forward. APHA has also supported several proposed rules at EPA. One proposed reconsideration of California's advanced clean cars waiver, and another proposed rule to phase down the production and use of hydrofluorocarbons. So APHA is constantly monitoring rules coming out that would impact the public health to weigh in and provide support for those that would have a positive impact on people's health. And other issues not having to do with new proposed rules, but issues where APHA has reached out proactively to try to make sure that these agencies are working on things that are good for public health. One is an instance where APHA urged the White House Office of Management and Budget, or the OMB, that any forthcoming updates to the social costs of carbon used by that agency, we're asking that they adequately account for the health impacts of climate change, because as I'm sure many of you know, climate change is a health and public health issue. APHA also contacted the Department of Transportation, recommending the rescission of rules that undermine setting strong pollution controls on the transportation sector. And APHA has contacted EPA a bunch. We contact EPA a bunch. And one of those reasons was to immediately revoke food tolerances for pyrophos and initiate the cancellation process to end all uses of that pesticide, as well as joining a petition to EPA requesting a review of their previous rule on national ambient air quality standards for ozone. So APHA is constantly getting in touch about forthcoming rules that we support, forthcoming rules that we oppose, as well as trying to get in touch with agencies about rules that might not be out yet, but finding ways that we can provide input so that those rules do have a net positive effect for the public health. Now that we've discussed our priorities for this year, we hope that, you know, as you guys are planning meetings or writing letters or making phone calls or getting engaged in your own advocacy efforts, that you can take what you've learned about our priorities and hopefully talk about some of those priorities in the advocacy that you're engaging with. We will be posting this presentation as well as sharing the slides with you. So you can always come back and watch it again or look at the slides at your own pace if you want to go over some of these things. But now that you have kind of an in-depth look at what our advocacy priorities are to use in your own personal advocacy, we want to share with you some opportunities for advocacy and materials that you can use in our upcoming Speak for Health campaign, which if you don't already know about, you are about to learn all about. So grassroots advocacy is something that we always are trying to engage APHA members in, because not only does it amplify our existing advocacy efforts, but it gives you guys, APHA members and APHA leaders, an opportunity to, one, utilize your public health expertise, whether that is in dental care or environmental health or gun violence, weighing in with what you work in every day and what you have professional expertise in, but also utilizing your constituent perspective, because the fact is that APHA and our government relations department are here in DC, but sometimes you guys can have an even more significant impact because you do live in these communities where key members of Congress live. And as I'm sure many of you know, members of Congress pay special attention to what their constituents are talking about. And you guys live all over the place, and we want to take advantage of that. Statistics do show that constituents weighing in with their members does have an impact on members making decisions. 83% of staffers cited that personal reasons are a main driver for a member's decision-making, and that final decisions often come down to communication with staff. And you can oftentimes influence a staff member's knowledge or perception of an issue based off of those meetings that you have, whether that's a meeting that you're having with the member themselves or a meeting that you're having with a staffer of that member. Both are important. So never think that just because you're not meeting directly with the member that your voice isn't being heard, because in many and most situations when you're meeting with a staffer, they're either relaying that information directly to the member, or you're at least informing that staffer's perspective for when they have later conversations about that issue with the member. And that's why we want to push you guys to schedule meetings and get involved in your own advocacy, because it really does have an impact on the decisions that are being made, the bills that are being introduced, the bills that are being considered by committees, and the bills that are being voted for. So because we are so excited about you guys potentially getting involved in your own advocacy efforts, we have here at APHA what is called the Speak for Health campaign, which is a campaign that's all about you guys. It's all about our members, all about our APHA leaders, and it's about giving you guys an opportunity to find advocacy opportunities for yourself, weigh in on our priority areas, and use materials that we have created for you to boost your own advocacy efforts. So we try to provide a range of different resources like fact sheets and talking points and tips on how to schedule meetings and get involved in advocacy. This webinar is a good example. Like I said, we're going to post this later. So if you want to watch it again or share it with any of your colleagues who are also involved in advocacy or just interested in getting involved in advocacy, please feel free to do that. We encourage all of our members, leaders, and affiliates to get involved. So please feel free to share widely, because ultimately what the Speak for Health campaign does is enhance the collective public health voice. So now I want to walk through some of the resources that we provide for you guys. This is both letting you guys know about different advocacy opportunities, letting you guys know what materials are out there that you can use, and letting you guys know about effective strategies for engaging in advocacy. So one of the first things that I'll walk through are some tips for setting meetings with Congress and holding those meetings. So of course, getting a meeting with a member of Congress is only one way to engage in advocacy. There are many, writing letters, engaging in action alerts, going to town halls, making phone calls. But a consistently effective way to engage in advocacy is to request meetings with your members of Congress. And not only is that very effective, but with the rise of virtual meetings, it is more accessible than ever before. Previously, the Speak for Health campaign was mostly centered around August because during the month of August, both the House and Senate have congressional recess, which means for most of the month of August, members of the House and Senate are actually back home in their districts, which makes them more accessible to their constituents, wherever they may live, whether that be Kentucky or Idaho or California or Nevada. So during the month of August, because they're at home in the district, it's easy to set up, or easier to set up district meetings rather than having to go to a fly-in all the way in DC. Now, of course, with the advent of virtual meetings, you don't have to meet in person. If you want to meet in person and feel comfortable doing so, August is still a great time to do that because they will be home in district. Or you can just, request a virtual meeting on a Zoom platform or something like that. So we'll just walk through some tips here on how to request those meetings, what you should expect, and what to do during the meeting. So one of the things when you are confirming logistics with staff that you've requested a meeting from, in the case of a virtual meeting, you definitely want to make sure you are confirming who is sending that virtual meeting link and what platform it is. So is it Zoom? Is it Google Teams? Is it Microsoft Teams? And make sure that you share that well in advance so that everybody has the link. And when starting the meeting, you want to make sure that you start the meeting on time, if not a little bit ahead of time. It's always a good idea to start 10, maybe 5 minutes ahead of time to check everybody's systems, make sure everybody's technology is working well so that you don't have any issues during the meeting itself, because you don't want to waste valuable time when you could be talking about the advocacy priorities that we demonstrated in the slides before. And so this is a good way to stay prepared for meetings. We also have some tips later in the slideshow, which I'll link to in the slides that we'll be sharing with you guys on a draft of like a meeting request. So if you've never requested a meeting with a member of Congress before, it's really not that difficult. I know it sounds a little intimidating, but really you just need to call the office, get the name of the scheduler or staffer who works on that issue, and then use our provided draft as kind of a template for what to ask. Really, they just want to know what date and time you're requesting and what topic you want to talk about, and if you're a constituent. Other than that, that's most of the information that you need to provide. And the worst that they can say is no, right? So we're definitely trying to encourage you guys to set up meetings with your members of Congress. Some more tips during the meeting, once the meeting is started, you definitely want to be concise as you're explaining the issue that you're talking about. You want to hit some specific points, one of those being explain who you are, why you are the right person to talk about this issue. Do you have professional expertise? Do you have personal experience with the issue? And then go into what the issue is and what your ask is. You definitely want to plan ahead as well. This is especially the case if you're part of a group, to avoid instances of everybody talking at once or talking over each other. If you plan ahead of what points is being discussed by who, then you can run a very smooth presentation moving from one person to the next, and it'll look very smooth and very professional, and you won't waste any time talking over each other. And just a few more tips here for the end of the meeting. You always want to be prepared to answer questions, because oftentimes, especially if it's kind of a meaty subject, the staffer will have questions, whether it's about the research or about the bill. And you want to have done a little bit of research there to be able to answer their questions. Even if you can't answer their question, that's okay. It's no big deal. Just make sure to follow up with them later and try to get them the answer to that question. That's also a good way to open up a line of communication between you and them. On that note, you also want to offer yourself as a resource to the staff member and their boss, the member of Congress, so that, you know, even if that issue is not advancing today or tomorrow or this week or this month, in 6 months from now, a hearing and a key committee could pop up on that topic that you talked with them about. And if you've offered yourself as a resource and demonstrated that you are an informed expert on that topic, they might reach out to you saying, like, you know, what legislation should we support? What should we vote? What should our talking points be? Something like that. So it's always good to offer yourself as a resource and provide materials to whatever you're asking for. You usually want to provide those materials before the meeting starts. So if it's a virtual meeting, it's good to attach those materials to the calendar invite. Or if it's an in-person meeting, you can email them beforehand, or at least bring a paper copy of them to hand to them so that they can go over that beforehand. It's usually good to bring any research that you're referencing, fact sheets on the issue that you're talking about. And I'll discuss a little later, but we do have a lot of great fact sheets that you guys can use on various of our priority issue areas like gun violence and public health funding. And finally, after a meeting has concluded, just follow up with a thank you email to let them know that you are thankful for their time, offer yourself as a resource once again, and let them know that you're there to answer any questions that they might have in the future. So those are some ways that you can, you know, schedule and run a meeting with a member of Congress. It's really a lot less complicated than it seems, as I'm sure many of the people here who have done it before would vouch for. Now, I wanted to go over some of our advocacy resources that you can utilize, whether that is in a meeting with a member of Congress or in some other forms of advocacy. One of the other forms of advocacy that's so simple and quick and easy that you can engage with is the APHA action alerts. These are action alerts on our website, which you can navigate to by going to our website and clicking on policy and advocacy, and then they're under there. And these are just quick emails you can send to your member of Congress by putting in your address. It'll automatically select who your member of Congress is, and you can send these action alerts on various topics. We have current action alerts up on gun violence, on public health infrastructure funding, on racial equity. You can choose the one that you're most interested in to send, or you can send them, you can send all of them. We would love to see that. So some of the key points of our action alerts is, one, they're able to be edited by you, our advocates. So we've written kind of a general outline of what it should say and like what legislation it should talk about, but there's room in there for you to write your own personal stories or professional experience. Because ultimately, you know, we want members of Congress receiving a lot of emails on these issues so that they see how much support there is. But 100 different emails on gun violence is going to look more impressive than 100 of the same emails on gun violence, because one is clearly people have put more time and effort and thought into than just, you know, what some consider a form email. So we definitely recommend and suggest personalizing it to your heart's extent. And then be specific. Once again, we want to utilize the fact that you are a constituent of this member's state or district. So if you could give details on how that issue is impacting your own district or state, that will boost it even more. And so we definitely recommend personalizing. I've dropped a link on this slide directly to the action alert page. And like I said, I'll be sharing these slides with you guys later, so you can go through it on your own. Now I wanted to share some other resources that you can use in your own advocacy efforts. one of the best ways to stay involved with advocacy is just to keep track of what we're working on so that you can kind of, echo what we're working on in your own advocacy efforts. One of those resources that you can use is here. We've linked to our 117th Congress Advocacy Priorities page. This is what we discussed earlier, the 6 priorities that we've deemed are APHA's top priorities for 2021. And this document details what those priorities are and what the issues are underneath them that we're engaging on. So you can look at more detail in that by clicking on the link. Another is our APHA legislative update. If you are a member of APHA, you probably get this in your email once a month. And this just provides a bunch of stories on what's been happening in Congress relating to public health and what APHA has been advocating for, as well as what's been happening in the administration, what's been happening in agencies and courts, et cetera, et cetera. So this is both sent to your email, posted on the website, and there's a monthly call going over it. So you should really be, if you want to stay up to date with what APHA is working on and what Congress is working on, there's 3 different ways: email, website, or the monthly call. So you can get involved with one of those, and they're posted at the link here. We also always post letters to Congress and federal agencies that we've joined through various coalitions or letters that APHA has written specifically to members or committees. And you can check out very specifically, literally everything that we're working on every month is posted there. You'll probably see not everything that we do and work on is necessarily under an advocacy priority. Obviously, our priorities are the biggest issues that we work on, like gun violence and climate change and racial equity. But if you check out our letters to Congress, we also do a lot on a lot of other issues. We do a lot that pops up under nutrition, a lot on smoking and tobacco. Just as things come up that have significant impacts on public health, we try to weigh on them. And then under that same branch, we post any testimony, comments, and briefs in the courts that we've weighed in on. And you can check those all out at that link there. So all the links on these pages are a good way for you to just stay up to date with what APHA is doing. And hopefully, we'd love to see you guys echoing what we're doing in your own advocacy efforts, whether that be at the federal, state, or local level. Here are some other materials that you can use. We have several materials listed here. If you are, encouraged to set a meeting with your member of Congress, we've got some links here on how to contact a congressional staffer. We've got that email template that I was talking about, which you can customize to your own needs. We've got some tips for meeting with a member of Congress and some do's and don'ts. And then I provided a link down below to our Speak for Health resources. The Speak for Health page on our website has such a wealth of great fact sheets and infographics and anything that you could use for a meeting or your own advocacy efforts. So for instance, one way that you would use our Speak for Health resources, if you are, a professional expert in gun violence, or if you're not an expert but want to meet with your member of Congress about gun violence, you could use the documents here on how to plan a meeting with your member of Congress to request a meeting. Once you've got that meeting, you could go to our Speak for Health resources page and go to the gun violence tab if that's the issue that you're interested in. And you could find under the gun violence tab different fact sheets and resources that you can print out and use. They're like one-pagers and infographics and fact sheets all about gun violence. So really, you don't even have to be an expert on gun violence to set a meeting with your member of Congress and talk about gun violence with them. So, whether it's something you want to talk about on gun violence or public health funding or climate change, we've got so many good fact sheets and one-pagers at that Speak for Health website. That's definitely one of our most robust advocacy resources because there's so many different issues reflected on that page. So you can go there by clicking the link here or just by typing in Google APHA Speak for Health and you'll find the page there. And finally, some last advocacy resources that we will share. Like I said, we've got lots of infographics. If you want to do like some cool social media posts during the month of August, we highly recommend that. reports and issue briefs on various issues like our priority issues or other things that APHA often engages in. We've got an annual congressional vote record, which is a good way to see what your member of Congress's score is in terms of public health. So this is generated at the end of each Congress, looking at how a member has fared on key votes. So we take a list of public health votes and generate this scorecard and give different members ratings. So this is a good way. If your member is great on public health, you can reference the vote record and say, thank you for being such a champion. If they're, medium on public health, you could say, hey, you're doing like pretty good. Here's some ways you could get 100 on this scorecard. And if they're awful, tell them that they're awful. I'm just kidding. Don't tell them that they're awful, but encourage them to do better for the public health of their constituents. We've also got our policy statement database linked here. This is a great way if you really want to delve into the specifics of a policy issue. You can check out our policy statements. You can search that database for pretty much any public health keyword and find a lot of good, well-researched and past policy statements on a number of different issues. We also have some webinars linked here if you are interested in learning more about any of those issues. And just one more note, at the Speak for Health page that I referenced before, you'll find fact sheets both on different issues like gun violence and climate change, et cetera, et cetera, et cetera. And we've also got some state fact sheets up on that website, which you'll find on the Speak for Health page. And those state fact sheets have public health information for every single state. So if you are from Alabama and want to talk more specifically about public health funding in your state, you can download or print off the Alabama state fact sheet and take that into whatever advocacy you are doing, whether that is a meeting or a phone call or a town hall. And those are also currently being updated. So the versions that are currently on the website aren't even that old, they're just from last year, but they will soon in the next few weeks be updated with brand new 2020 information as well. So those are soon to be updated. So those are all of the ways that you can get involved in advocacy and the materials we have for you that you can use. At this point, we can open up for some questions. Does anybody have any questions about APHA's advocacy priorities, opportunities for engaging in advocacy, how to engage in advocacy, or materials? Anything at all? I'll check the chat. See if we've got any there.
This is Don. We do have, I know we have some of our action board members on the webinar today. So if you're from a specific section, don't be surprised if you, over the next month, get multiple emails, not only from Jordan or myself on behalf of APHA throughout mostly the month of August into September, maybe even starting late this month, alerting you, reminding you, asking you to take action during Speak for Health. Don't be surprised if you also then get a follow-up from your action board member or other leader within your section, because we will be encouraging those folks who many of which are you, to also help us kind of reiterate and do some follow-up with the groups that you represent, whether you're an action board member or a section chair or anything like that. It's always great to have a reminder from a friendly name or face, encouraging you to try to take some action during the Speak for Health campaign.
Exactly. We had a question from Carol. Carol, could you flesh out your question? I don't think I totally understand it, but I'd be happy to try to answer.
Sorry, yeah, one can only type so much. I was hoping that you and or Don could describe for the people on the call what role when a section or an affiliate has an issue that they feel APHA attention would be a good thing to. How do we interface with you about that, and what is your usual role?
Sure. So that's technically not what this webinar is about. However,
I know, but it certainly deals, it's a
however, I
question
will
of
answer the
advocacy that
question.
we're
Yeah, you can
specifically
always
interested in.
bring the issue to our attention. We generally ask you to do that through your section leadership, because, you know, it would be very difficult if we just had every random person who had a thought about an issue come to APHA staff. We obviously can't handle those many requests, but if your section has, you know, a letter they want APHA to consider signing or something like that, you can certainly bring that to my attention or Jordan's attention. But would always encourage you to work through your section leadership to do those kinds of things.
Which is always a good idea because the section leadership may already know of somebody else who already did it or what else has happened within the section. So
right.
yes.
Yeah. And or there may be disagreement within the section on that particular issue. And we wouldn't know that if somebody just came to us and we said yes to everything. So that's another reason we ask you to do that.
Exactly. And since there are a lot of future section leaders on this call, I think that's a good point. Thank you.
Yeah.
Okay, I think that was the last of the questions in the chat. So if anybody else has any questions that they want to ask in the chat or just unmute yourself.
Actually see, oh, sorry, Jordan, it came to me as a direct message. So why don't I answer this? Is there a value in promoting citizen or organizational send-in messages to legislators or sending material to the legislator after contacting the office prior to or short of an actual meeting? Yes. So this, I think the question is it worth it to send an email with information or a request to the office, asking them to co-sponsor a bill or vote a certain way, et cetera, et cetera? Definitely there is, as a constituent. Now you can do some of those things through the APHA action alerts if it's on a particular priority issue that we have an action alert on, or you could simply call the office and ask for the name of the person who handles the issue that you're interested in, particularly if you're asking about something that's maybe not an APHA issue. You know, this webinar is obviously about APHA's priorities, but certainly you can use all these same skills and ideas and concepts for advocacy you do for other organizations and, you know, other issues that you care about. So it's all, you know, the process is pretty much the same. They want to hear from experts. They want to hear from people who work on these issues, who are their constituents. Now they may not always agree with you and they may not always do what you want them to do, but they're a lot less likely to do what you want them to do if you don't say anything to them. So, and there are stories of people who are, you know, able to, maybe they can't get the person to like switch their vote on every single issue, but they can get them to moderate their views or listen to other perspectives and learn more about the issue. Because and another good thing about doing outreach, even if you think, oh, well, my members of Congress already vote the right way and they do the right thing. Well, that might be true, but a lot of pieces of legislation never make it over the finish line. And a lot of the work to get them there is kind of behind the scenes work. And so if your members of Congress are, you know, hearing from lots of people about the Public Health Infrastructure Saves Lives Act, we're hoping that they're then going to their leadership and saying like, hey, we're getting a lot of people talking to us about this issue. I really want this to be in the infrastructure bill, you know. So that's another example of how weighing in can, you know, while your member might, if it's in there, think that's great and vote for it, but are they going that extra mile and actually doing outreach to their leadership and saying like, this is a priority for me? That's a good way to build that. And take a person with a perfect voting record and make them an even bigger champion for our issues. So that's something, because we often hear from members, oh, well, I'm not going to bother because my member of Congress always votes the wrong way, or, oh, I'm not going to bother because mine always vote the right way. That might be true, but there are things beyond that that still matter, and hearing from constituents is helpful. Even if you don't get your desired outcome every time, it's good to be persistent. And you can be persistent without being annoying or obnoxious. You know, it's just it's worth it staying in touch with them and their staff and sending them additional information as you find it, to keep them educated about a particular issue can often help. Yes, there are going to be some members who are just a lost cause and you're never going to get them to change their position, but you know what? Most of them aren't going to be there for life. You're going to get a new senator or a new representative, so you'll have future opportunities as well. Or who knows, maybe one of you will actually think about running for office someday on a public health platform and challenge somebody who's maybe not so good on public health issues. So
We'll vote for you.
yeah, exactly. We'll move to your district and vote for you if you do that. All right, I think we have time for maybe one more question if anybody has anything. Or Anne, I don't know if you wanted to, Anne, our action board chairs on, I don't know if you wanted to say anything. I'm not putting you on the spot, but you have the opportunity if you want to have a 30-second pep talk or whatever, talk about why it's so important.
Sure. Thank you, Don. And thank you, George. This was a great presentation. I just really want to encourage everyone to engage in advocacy and encourage the other people you interact with at APHA in your sections or family members, friends, get everyone involved and don't be scared. I think if it's the first time out for a lot of people contacting an elected official, they're nervous, they don't want to mess it up. My experience has been, it's a very positive experience. They're always happy to talk to people. They're happy to hear what you have to say. Don't feel like you need all the answers. I just would really encourage you to get involved.
Awesome.
Any last words?
That was a little threatening.
And any words of wisdom for the group before
Right.
we go?
Okay, if not, thank you so much to everybody who was able to join us for our Speak for Health Advocacy webinar for leaders today. Like I said, we will be sharing two things with you guys after this. We'll be sharing the slides themselves, so you can go through those at your own pace, click all of the links. Please feel free to share those with your sections, with your fellow advocates, with your anybody who you work with that's interested in advocacy. And the second thing we'll be sharing sometime soon, we will be posting this webinar video on the website, probably on the Speak for Health page. And once again, that is something, please feel free to share with other APHA members, with sections, and with your colleagues. So I hope that you feel encouraged and emboldened to engage in public health advocacy and look out for those things that we'll be sharing. Thank you so much to everybody who was able to join us today, and have a lovely rest of the week. Bye, everybody.
Thank you.
Thank you.
Bye.
Thanks so much.
Hashtag Speak for Health.
Thanks, Deanna.
Welcome. They were asking for one.
Yeah.
You guys did a great job,
Thank you.
as always.